Hi, my name is Jeff Curry and I'm here to present a brief presentation which is part one of a cultural competence workshop. Unfortunately, the ANZSNM 2020, the 50th anniversary meeting was cancelled for April 2020 and I was going to do this workshop as part of that program. I did the workshop previously at the SNMMI in the USA. And obviously when we talk about Indigenous cultural competence, we're not just talking about Australian Indigenous peoples, we're talking about the people who are Indigenous to all communities. So in the S&M, we actually had very good response from both North American Indigenous folk as well as Indigenous communities from different parts of the world. So it was actually a pretty engaging conversation. Because we've taken this platform outside of the face-to-face I guess environment, it becomes a little bit more difficult to have that engaging conversation. So what I want to do is try to break it up into two parts, and the first part will just be sort of talking a little bit about some theory that then can challenge some of your thoughts to take away and think about that, and then hopefully through the ANZSNM we can actually set up some form of live discussion that would allow us to then come back and think about the ideas and share those ideas moving forward. The other thing that's really important to consider in the discussion about building foundations for Indigenous cultural competence is that when you actually look at the ARPRA capabilities or our professional capabilities in any other domain, whether you're a physician, a physicist, whether you're working in a public or private sector, is that we don't actually talk about Indigenous cultural competence. We talk about cultural competence. And it's really important as health practitioners and as citizens of the lucky country that what we need to be able to do is be culturally competent. And what does that mean? Is that why are we going to focus on Indigenous? And the reason for the focus on Indigenous is because sometimes you've just got to take a prototype approach to things. You can't learn every pathology, or you can, but it just takes a long time. You can't learn every drug. Well, you can, but it takes a long time. And so when we teach those things and when we learn those things, we actually learn the foundations, or we pick a prototype type approach. And if we actually have a good understanding and grasp of that, then we can apply the skills and understanding we get from that particular learning experience into similar or parallel areas. So we do this all the time in science. We do it with the protocols you do use in a clinical department. And it's actually a reasonable way of learning. So because in Australia we actually have a number of challenges around Indigenous health, and the Indigenous Australians are obviously the Indigenous population to Australia, then it's actually a really logical prototype approach to cultural competence. So if we focus on building those bridges to cultural competence with our Indigenous folk, then we can use those same skills to apply them to cultural competence in relation to any other group of people in the diverse melting pot that is Australia. So that's just an explanation of where we're going. We will focus on the Indigenous issues, but the whole idea of this is to actually think more broadly about the thinking and the skills that you develop as part of Indigenous cultural competence and how they can be applied to be more broadly not only culturally competent but culturally proficient, and we'll talk about that a little bit more shortly. So the objectives here are that we're not here to talk about the initiatives that Charles Sturt University, which is my employer, have adopted in our courses and the things that we've undertaken to build Indigenous cultural competence. If you're interested, you can actually look at some of those things in a journal publication. So in the Journal of Medical Imaging and Radiation Sciences back in 2018. And that article kind of celebrates a few of the things that we've done at CSU to ensure that our graduates, not just in nuclear medicine, but across the university, are culturally competent and in particular have Indigenous cultural competence. It's probably worth mentioning that the reason that there's some leadership in Indigenous cultural competence coming from both CSU and from the nuclear medicine program is because the medical radiation science program, which includes the nuclear medicine, radiography and radiation therapy, was actually the first course at Charles Sturt University to actually get the tick of approval for being by the Indigenous Board of Studies to have actually adopted throughout, rather than a tokenistic approach to a couple of Indigenous subjects or an Indigenous subject here or there, to actually have the Indigenous cultural competence weave through the entire program. So it's actually taken a lot of work, and the medical radiation science program at CSU actually provided the leadership and the prototype for other courses to follow. And I was central to the initial program that was set up. And so what we do want to do is we want to explore, how we can apply the understanding of Indigenous needs and the barriers that, create, I guess, some barriers or difficulties in terms of the cultural spaces that we operate in for both of our students and our colleagues and our patients. So when we talk through this next little section, sometimes we'll talk about students, because I think that they're the future professionals in our careers or our communities. And so, sometimes the easiest way to actually develop cultural change or cultural skills is to come in from the grassroots. So it's really important that we educate our students, and clinical sites are a crucial part of that education. Universities don't do it on its own. We can actually have some theory in there that we say, well, this is what we attempt to do with our students, but we really can't achieve very much at university unless we have the support of our clinical sites that actually reinforce those skills and capabilities. And so, and then we want to develop those in our workplace. And so the focus is, on the diversity, the culturally diverse workforce that we actually create from students and that you're currently immersed in, and then to be able to cope with a culturally diverse patient group as well. So I guess that one of the things that we need to do is obviously start to think really at grassroots level. And some of if you've had the opportunity to talk to one of our colleagues, Peter Chuali, who with Matt Ayres and I were the founders of RAINS, he's very passionate about Indigenous health and Indigenous nuclear medicine in Western Australia, and trying to actually close the gap between I guess the needs of Indigenous people and the rest of the community. So if we think about the First Nation people, and it doesn't matter whether it's Australia or other communities elsewhere, and even across the ditch in New Zealand, is that I was over there last year, and one of the important things that came from the New Zealand branch meeting of the ANZSNM was this introduction by the Health Minister, who talked about the challenges as a Maori himself, and the challenges that his community had faced growing up, and the health disparity that still occurs for the Maori people. And so when we actually talk about First Nation peoples, it's not just the Australian Indigenous community, it's the First Nation people of almost every community. And so they're substantially disadvantaged by colonisation or colonialisation. And so this manifests in almost all aspects of the perception of quality of life. And this is a really important concept, because we measure health and well-being based on what the Western paradigm of health and well-being is. And so, if I asked each of you individually to write down what are the ingredients for health and well-being, is that you might find that those of you who have an Anglo-Saxon background will have a very different list to someone who actually has an Indigenous background, whether it's Australian Indigenous person or someone from another country. And it's because what we value in terms of quality of life can be quite different. And so it's really important that we get the values of quality life properly defined. So if we scale that back and think, well, what are the things that are going to be common? And they're not always necessarily common, but in a broad sense, health and education are those common threads to the perception of quality of life. And so what health is to a Western person versus an Indigenous person, and what education is and educational opportunities can be quite different, but they're still there and they're still weaved through the community. So the manner of that education providers and the clinical departments develop and apply a cultural competence to enhance the understanding of the social, historical and cultural determinants, and then apply that understanding to adapting and implementing culturally appropriate learning and workspaces is really important. And so I guess that as an introduction, that's what this presentation, this workshop's about. It's about arming all of us with some sort of understanding of what those barriers are. And, you don't actually have to, and so sometimes it's about perception. And so when you look at the historical records, is that, you can actually get 2 or 3 or 4 different versions of the same event. And so you don't have to subscribe necessarily to a particular historical viewpoint. What you need to do is actually understand how your viewpoint is different to somebody else's and how that can actually create some cultural roadblocks. And so we need to think about those social dynamics and how those historical disparities influence how we interact with each other. But most importantly, we need to think about how they actually are brought into, from a cultural perspective, into our workspaces. And so in your workspace is that you'll actually have differences in cultural viewpoints amongst colleagues that have different cultural backgrounds, and some of those might be Indigenous and some of them might not be. And some of your patients will be Indigenous and some won't be. And so how do you actually ensure that you actually have a culturally safe place for all, not just for some? So that's actually a really important thing to note. The other thing is that we need to be aware that for some people there is a stigma attached to certain cultural, religious, or gender or sexuality based identification. And so it's really important to understand that people identify for different reasons. And so there's people that will come into your department who are either staff members, they're students, or they're patients who don't actually identify as being Indigenous or Islamic or any other particular cultural background. And they don't do it because they feel like it may be a stigma or it may disadvantage them. That for whatever reason that there's a barrier and that they don't feel like their cultural needs will either be accommodated or understood. And as healthcare workers, I think that's the real barrier for us and it may not be true, is that perception is reality for some people. So that's not casting dispersions towards any of us. What it's really saying is that perception is reality. And so if there is a perception amongst the Indigenous community that they will be disadvantaged in a Western paradigm health clinic, then we need to overcome that barrier, even if that there is a really culturally proficient team and environment in which for that person to come into. So the fact that there's a perception that is disconnected from reality doesn't mean that there's no problem. It means that there is a problem there that needs to be overcome. So that probably actually is the underpinning issue that we confront with creating culturally diverse communities. When I say community, it's not just the community in which we live, it includes the community in which we operate our services, so our nuclear medicine departments. It's the square peg round hole sort of mentality. And so there's a number of risk behaviours that are more frequently exhibited in Indigenous populations. And this is actually a really difficult thing because sometimes people will actually have a bias about how they perceive someone, that there's a blame attached to that if Indigenous communities actually have a higher risk behaviour of certain things, whether it's drinking or cigarette smoking or other things, then it's almost they feel like they're being judged. And I think that our job is not to judge. And I think that the nuclear medicine community that I know in Australia and New Zealand, they don't judge, but perception is reality, and we have to be, arm ourselves with the capability to make our patients feel comfortable and make them realise that they're not being judged, that there's no blame being put on, that we actually are culturally open and safe. So the greatest social determinant of health for Indigenous people is related to overcrowded housing, homelessness, lower levels of education. And when I say lower levels of education, that's westernised education. And we need to keep in mind that what we consider as a Western civilization as being a poor marker is not necessarily a poor marker in some other cultures and communities. It doesn't have to be Indigenous communities as how I live my life. And how my family lives in terms of the space that we have, amongst just my close family, but then my extended family can be quite different for different cultures, not just Indigenous communities. Where, I have friends who come from another number of ethnic backgrounds who have entire multiple generations of family living in the same house. And that's culturally, it's not a financial issue, it is a cultural thing. And for me, that's something that I, would struggle with in terms of, the closeness of that family. And so what we see as overcrowded housing, or what I might see as overcrowded housing, to someone else might actually seem like it's actually a really comfortable, homely, safe environment. And the same relies on lower levels of education. So it's westernized education. It doesn't mean that people are not smart. It doesn't mean they don't have other forms of education and life skills that go with it. But with lower levels of westernized education comes poorer numeracy and poorer literacy, and that creates its own barriers. Those barriers can include, a lack of trust and some confusion, and of course lower income levels as well. So these statistics highlight that the Indigenous people's paradigm, which we could call a square peg, doesn't necessarily fit the westernized paradigm, which is the round hole. And so what we're doing is we're trying to force a square peg in a round hole, and it doesn't necessarily work, and it doesn't necessarily provide the solutions that we're after. So what are some of the barriers to learning? Recent evidence has identified that there's three key characteristic values by Indigenous Australians that are equally valid whether you're looking at the healthcare sector or the education sector. So whether the people are coming in as patients or whether they're coming in as students trying to learn and become nuclear medicine technologists. And those things are accessibility, so having spaces that are welcoming, and what do we mean by welcoming? For one person, welcoming means that there's a person at the front of the lecture room with a smile on their face that says, hi, how's it going, good morning, take a seat, and is all friendly. And for someone else, it's not about the person at the front of the room, it's about the space itself. It's about the safety of the space. Do they feel comfortable? Do they feel like they're engaged with their environment? And I'll show you some unique ways that we overcome that at CSU shortly. And multiple services can be co-located. So, one of the challenges that we have experienced previously at CSU is that when students have to actually go to multiple buildings on different sides of the hill across a big campus to actually get all the things that they want, so they just don't do it. Whereas if you actually localize all the services in one spot, some of our Indigenous students are more likely to partake in those services that are available. If we extend that into our clinical sites, is that if the nuclear medicine department, the radiology department, and the doctor and the radiotherapy are all in different parts, quite substantially separated, then it creates a challenge, and those patients may not come back. And indeed, is it one of the typical scenarios that we might experience is the sonographer who refuses to do an ultrasound after the patient's had a thyroid scan injection. Right, so it's a matter of communicating with your staff to make sure that things get done in one go, because that patient's not coming back twice. And so if all of a sudden there's a tension between the staff and the workflow that we have that forces a patient maybe to actually have to come in for two procedures or two different times, or they have their nuclear medicine procedure at one location and they've got to go and have their CT at a different one because that's where it was booked, is that these are the things that we have to overcome. And so if you think about the nuclear medicine department integrated into radiology departments, we're having our CT built into our SPECT CT and our PET CT. We have this wonderful opportunity to create a more welcoming space, for our Indigenous community. And so then it needs to be culturally safe as well. So culturally safe, and this is really important, not just for our Indigenous community, but across the full diversity of cultural community here in Australia, is that you need to start thinking about some of the actual cultural beliefs and the rituals and the values that come with different cultures, and are they accommodated within the nuclear medicine department. I think that one of the ones that you see quite obviously in the USA is that a lot of medicines they actually have an animal base. It could be something like warfarin or heparin that might be porcine based, so it's pig based, and that may not be actually compatible with certain cultures or religions. And so they actually have a quite an extensive and public list of medications that are culturally appropriate, that is somewhat more difficult to actually find here in Australia. And so we need to think about some of those things within our department. And I think we're pretty right with a lot of those things. But when you watch a program, so Indigenous communities, they struggle with the idea of having their image taken. And we see that with some of our programming where it has to identify early on that some of the images may portray people who have passed, and so we need to just be quite aware of some of the cultural idiosyncrasies that we all need to accommodate. So just because we think something is okay doesn't mean that the way we feel comfortable is the way that everybody feels comfortable, and that's just a common sense approach to just about everything. And I think that in nuclear medicine we're pretty good at that. And then appropriate and responsive to holistic needs. And this is a really important thing, and not just for Indigenous communities, but for a whole bunch of members of our society, is that they want to be treated as a whole person. And so an Indigenous way of actually looking at health and well-being is they get treated as a whole. They don't get treated like a disease. They're not the hip scan in the waiting room. They're actually a person. They are a whole person, and we treat them as a whole person. So each of these characteristics and the Indigenous people's paradigm offer some specific challenges to both the learning environment at a university and the workspace that you guys will be confronting in the real world, and we need to be able to overcome those. And so this little diagram is not an Australian Indigenous diagram. It's a North American Indigenous diagram, but it actually is one that actually is replicated across many in one form or another across many Indigenous communities in the world. And what it represents is this central backbone where health, education, and culture and society are the key philosophies that are crucial to Indigenous communities. But we need to remember that how they define health and education and culture and society might be different to the Western paradigm. And then feeding into those philosophies, health, education and culture and society, you will have your Indigenous and historical knowledge, your economic development, history, law, governance, science, research methods, arts and literature, and of course spirituality. But in the center of that is health, education, culture and society. Well, if you actually broke that down, that's probably all of us. I don't think it's necessarily specific to Indigenous communities. Is that if we really stopped and thought about Western paradigm, those are the core things that are essential to all of us. And right now, as we record this in the middle of the COVID-19 crisis, is that if we start thinking across the world, what are everyone's priorities? Health, education, culture, and society, and we use those things in the periphery to make sure that we maintain those three core parameters. So if you think about education accessibility, because it all starts with education. So if we want to create a culturally diverse, and not just culturally diverse, but culturally representative workforce, then we need to start thinking about how we get a culturally diverse student body. And so if 95% of people who work in nuclear medicine are Anglo-Saxon, but only 50% of patients that we see are Anglo-Saxon, well, then we don't actually have a representative workforce. And so it's really important that we actually attract into our community, our professional community, a more diverse, I guess, range of cultures that represent the communities that we serve. And so the grassroots of that is to make education more accessible. And so from an Indigenous perspective, is it being able to actually look at how we get Indigenous folk into the higher education sector, to do nursing, to do nuclear medicine, to do radiography and other things. So the traditional academic and health institutions that we deal with, they don't have the same vertical and horizontal diversity that we actually would expect to represent our communities. In recent decades, we've seen a change in that, and it's not just been a change in Australia, it's been a global shift in the structure of our vertical and horizontal structure of diversity within our organisations, but we're still a long way behind. Is that and we've seen that with gender equity as well. Is if we think about gender diversity in the workplace, and I know that nuclear medicine, particularly nuclear medicine technologists, tends to be more females than males. And it always has been. Well, as long as I've been around, it has been. But if we actually look more broadly in STEM in Australia, is that it's only been the recent times, after decades and decades of hard work looking at equity and gender equity, it's really only now that we're starting to see the effects of that filter through, and we've still got decades ahead of us because that I guess that foundation of female leaders in STEM needs to take time to grow, because at the moment, 15 years ago, is if all the leaders were male, then you can't just instantly graduate a group of people to take over that leadership. They need to actually grow their skills and evolve. So it's actually been a very slow change, even for gender equity in STEM in Australia. And I know that we'll have another presentation, hopefully talking about that kind of diversity. But it's the same with Indigenous and other cultural changes. These things take time. Is that you can implant some cultural competence and proficiency at the foundations, and it takes generations for it to really build. So even though there's been a few decades that we've actually changed how we've looked at the problem and how we've looked for solutions, that it'll take generations to come before we actually see the full effects of that cultural diversity. So when we actually consider higher education accessibility, there's three distinct ideologies. One of them is the inherited merit, right? And we see this portrayed in US movies with Ivy League universities, where you've born into the right to have an education, and then we bump over to equality of rights, which is often focused on white person initiatives, but you've got the right to education. And it's true, is that if you think about and we can think about gender equity when we talk about this as well, because then you've actually got equality of opportunity, and there's a difference, right? So if we talked about gender equity, is that we can actually say that women have the same rights as men. And if we actually were happy to draw a line under that and say we've actually achieved what we need to achieve, because now we actually have equality of rights, it doesn't necessarily mean that it translates to the real world that you've actually got a change in the opportunity, right? So you can actually say that everyone has the same right, but if you don't actually have the same opportunities, then you don't actually change your workforce, you don't change your cultural structure. And so it's really important that we actually look at equality of opportunity. So it's not just a matter of saying we need to look at, every Australian has the right to health and education, right? So we've got equality of rights. But with equality of rights, we're actually not seeing, the same number of Indigenous folk coming into higher education or finishing high school. We're not even seeing the same number of Indigenous folk enrolled in secondary school. So even though we've got equality of rights, we're not actually seeing a change in the actual educational footprint. And if we have equality of rights for health, everyone has the right to health, but we actually have poorer health outcomes for Indigenous folk. But we also have poorer utilisation of health resources by Indigenous folk. So what we actually need to be thinking about is equality of opportunity, and that's true equity. Okay, so what is the opportunity? Is it to create, making sure that it's not just a matter of saying you've got the right to something, but let's actually pull the barriers down so you actually get access to it. Okay, so create pathways for Indigenous kids to come into university. And it's not just a matter of getting them into university, it's then creating pathways within the university system that keep them there. And not just for Indigenous folk, but also for all cultural groups in Australia. And then that changes your workforce. And this is important because, I'm sure that some of you, when I just said what I said on the last slide, are thinking, well, we can't lower the bar. It's not fair that Indigenous folk have a lower bar to get into university than other people. And I didn't say any of that. Right? So there is a perception that that's what that principle is about, but it's not about that. It's about saying, why is education system set up to deliver education in the way that a white person might learn? Why can't we also set it up so it actually is set up in a way that a Indigenous person might learn, or someone else might learn? So what we do and what we actually see in these progressive universities now, and Charles Sturt University is very culturally proficient, is that we actually accommodate the cultural differences amongst our students. And you can't always do that in the classroom. You can't sit there and go, okay, well, we're going to have 5 different class structures. But in terms of providing the support to students to make coming to university attractive in the first place, so it's a safe place for them to come, but also that it's actually a safe place for them to learn, that they actually feel like their culture is respected in that environment, and that if there is a barrier associated with their learning and culture, that we're here to overcome that with them, not to actually judge them based on that. So if students can't learn the way we teach in the Western paradigm, then let's teach them the way that they actually learn. And that's a little bit more difficult than you might think. So we think about those barriers to opportunity, right? Because we've all got the right to health, we've all got the right to education, but there's barriers for people to exploit that opportunity. So it's only when we start to explore and understand and build scaffolding to overcome the barriers to opportunity that Indigenous people can move towards true equity in both education and health. And that's not just in health outcomes for them, but also in health careers. And would be a richer workforce with cultural diversity. So at CSU, we're committed to close the gap, and I think that the language that I've used, and this comes from the university language, is that the idea of close the gap versus closing the gap. So the government mantra is closing the gap, and the word closing means that it's actually in action. It doesn't have an end point, right? It's not closed. We're closing it. We're just making a move in a specific direction. And I know that that's not the government's intention, but it's certainly the language and the way that that is often interpreted. So at CSU we use the word close the gap, right? It's closed. We're going to close that gap. It's not closing. We're going to close it. And that's a more definitive strategy. And so we're committed to close the gap for Indigenous Australians with true equity of opportunity for higher education, creating diversity in the graduate workforce, the workforce that you guys will all employ. And what that does is it affords the consumers of our health services on the other end exposure to a more culturally rich and diverse workforce. So a pretty good bottom-up approach. And so cultural immersion and targeted education around the history, the challenges, the needs of Indigenous peoples, and looking at that through the lens of the Indigenous person provides cultural competence for all of our graduates at CSU and our staff. So all graduates are required to immerse themselves in that Indigenous cultural competence, and all staff go through Indigenous cultural competence training as well. And in doing so, Charles Sturt University has actually got a pretty big achievement, to be honest. And one of those things is that we have the highest proportion of Indigenous students in Australia. And more importantly, we have the highest retention and completion rates of Indigenous students. And this is actually an interesting thing. And the photo there is our Vice Chancellor, Professor Andrew Van. All of our graduates, and not just at CSU but at other universities, they have their Indigenous scarf that they wear, the red, yellow, and black, in conjunction with their other graduate gown. But I think that one of the things that I've noticed is, and this is actually a demonstration of creating culturally safe learning spaces, is that I don't necessarily think, certainly in the medical radiation sciences, because in the medical radiation sciences is that we can see student data, and so in my class is I know which students identify as being Indigenous in terms of their government application, but I also know then which students are not do not identify as being Indigenous in the social environment, and there's a difference, right? And so I don't necessarily think that, certainly in medical radiation sciences, that we're actually seeing more Indigenous students enrolling in our courses. What we're seeing is more Indigenous students being loud and proud and being prepared to identify as being Indigenous students. And what that actually says is something really, really good. What it says is that not only are we this safe place for them to come, but we're a safe place for them to be them, that we're actually creating a culturally safe place that allows them to identify as who they want to be and who they are. And I think that that's a really, really important outcome. And so then in terms of the retention and completion rates, those retention and completion rates are independent of how the student identifies. That's based on how they identify in their paperwork. So that's actually really good outcomes, and that comes from the hard work we've done for over a decade now in creating those safe opportunities, safe cultural places for our students that break down those barriers to opportunity. And so we have, this is a Wiradjuri, and so for those who are not from, Dubbo, Orange, Bathurst down to Wagga Wagga, that whole area is Wiradjuri country. And so this expression in Wiradjuri language, it basically translates to something loosely as living respectfully in a world worth living in. And this is the philosophy at CSU, and it underpins all of student education. It underpins the research that our academics do, and we seed and nurture that philosophy in all of our students. And so essentially, if we start thinking about our cultural space, we need to think about our cultural space as not necessarily being a physical space. Okay, so our new cultural space is actually a way of thinking. It's the way that we weave this kind of concept, living respectfully in a world worth living in. And so it's not only about respecting Earth and resources and each other and our beliefs, but it's also about doing our bit to make the world a better place. And when you link those two things, it becomes a really good cultural space. And it's a journey. It's not, there's no beginning and end, although this diagram suggests there's a beginning and end. But when we scaffold that learning, we need to think, and I know that the topic that we've talked about is cultural competence, but there's a bit that goes beyond that, and this links to you guys, the reason that you're doing this. When we talk to our students, we're talking about having our students graduating with cultural competence, and that fits into the university's graduate outcomes. But in the course of doing your job, you get a few years under your belt, you're competent, you're capable, you're doing your job, you're providing leadership amongst the community, and you've developed those extra skills that go beyond what you learn at university. And so you've gone from just being culturally competent to being culturally proficient. And that's that translation from the generic skills that you learn at university into the ability to then to weave them into your professional behavior and your professional life. And so that's where you need to be. We need to be at a minimum of culturally competent and working towards cultural proficiency as part of our advanced practice. I don't think it's good enough anymore just to be culturally sensitive. Culturally sensitive is just, I guess, a way of saying that I'm going to tolerate, your beliefs for now, but I don't really respect them. And so I think that it's really important that we don't just feel like we can actually accept that culturally sensitive is an adequate spot to be, and cultural awareness. I think we need to be all moving past that and becoming culturally competent. Certainly if you're going to be working in the higher education sector or if you're working in the healthcare sector. And that brings us to another really important concept, and this is again not new to, or not unique just to Australian Indigenous communities. It's broadly used across Indigenous communities in the world, and this concept of nothing about us without us. For too long is that you've actually had white men trying to solve the problem of Indigenous health, education, housing, and everything else that goes with it. And if you've born in Northern Beaches of Sydney and you've grown up in a little mega mansion and gone to private school and had all the opportunities for health and education that come with being an Anglo-Saxon well-off family, then you can't, even if you become a minister, a prime minister, you can't connect with the challenges of an Indigenous community and what they need to get past. They don't need someone who is completely disconnected from their community and way of life, setting policy and setting strategies to try to make their life better. And the reason for that is because you're actually imposing the Western paradigm on the Indigenous paradigm. You're actually saying, okay, we're going through the lens of a white person, we're going to actually set the bar for where a good outcome will be for an Indigenous person. And it doesn't work, and it wouldn't work for you if someone was doing the same thing for you. Is that you could be Maori, you could be Islamic, you could be Catholic. It wouldn't matter where you are. Is if someone from outside of your community that hasn't grown up in your community, sharing your values and your challenges, the challenges have gone with your community, then they can't possibly have your support to write strategy to actually overcome the barriers that you've confronted. It just doesn't work that way. You'll accept their support, you'll accept their guidance, but it just doesn't work for them to sit there and say, okay, I know what you need, this is what you need. They don't know what you need. Okay, so this is the nothing about us without us, and it's really important that we don't accidentally, because sometimes this gets communicated unintentionally. It's not your intention to give the impression that one person is trying to tell someone from another culture how they should respond or react with a cultural challenge. And so it's really important that we don't accidentally disrespect someone's culture by trying to do this. And so this idea is that it's crucial that for it to work, Indigenous people need to be part of the actual process. Indigenous people need to be informing the process and driving the process. And Indigenous people are the first people to put their hand up and say, we can't do it alone. We need support, but we need to be actually driving that strategy. We need to be driving the bus, right? Otherwise, it's not going to work. And they'll call that nation building. And what nation building to a white person versus an Indigenous person is very, very different. The idea of nation. And so this idea of nation building approach, knowledge, skills, and capabilities that are developed, and it's transferable across the rich melting pot of the Australian community. So if we start to think about that concept of nothing about us without us, that applies not just to Indigenous communities, it applies to every cultural group in Australia. And so what it does is it gives us that cultural competence. It builds it through our student bodies, but it instills it in our staff as well. It creates safe and respectful learning environments. So these learning spaces for us to learn and grow. And when I say learning spaces, I'm not just talking about, the learning space in the university environment. Every day at work is a learning space. And it makes our workplaces accessible and attractive. It creates higher education pathways for Indigenous people that then translates to pathways into the workforce. In turn, it creates that rich and diverse workforce. It enriches and deepens the cultural competence within the university and within the graduate world, the actual nuclear medicine community. And that comes from actually having a culturally diverse graduate group. So it really is a bottom-up approach to close the gap, nation building through empowerment, and perhaps it's something more like something for us, from us mantra, rather than what we saw on the previous slide, being nothing about us without us. So if we think about our workspace, we need to think about the culture, the nation, not Australia as a nation, but the nation, the community that is Australia. And it's not just the physical community or the people community, it's the country, it's the fabric of our society. Ethnicity, the beliefs that go with that, the tradition that goes with that, the diversity that goes with that. So that's what culture is that, we think about the people and its ethnicity, the beliefs, the traditions, the diversity, how that builds a nation and how that drives a culture. And we can look at that in a macro perspective, being within the broader country, but we can also look at it on a micro level and think about how that actually builds within our individual departments, our universities, our teaching teams, our work function teams. And so if this was presented a few years ago by some of my colleagues that, they're trying to inspire all of our staff on how to better teach our Indigenous students. And this is actually the 8 ways of learning for an Indigenous person. And we were being told that we need to change the way we teach to ensure that we're accommodating the different learning styles of our Indigenous students. And of course, usually I'm pretty quiet on these things, but I actually sort of put my hand up and I said, well, I just have a quick question, and isn't that essentially how we all learn? Like, aren't we already doing this? Like, why do we need to change? Because surely, if we're good teachers, we already do all of these things. So as it says on the bottom of the slide, 7 of the 8 is how we all learn best, right? So, probably land links is the only one of all of these that I don't use in my normal teaching and learning. Use storytelling, using analogies. Some of the analogies I have from working with my colleagues, that some of them will be listening to this presentation, are used to drive student learning. You create learning maps, and I'll talk about the breadcrumbs shortly. There's non-verbal learning, and you've got the curriculum and the hidden curriculum. That's all part of learning. The use of symbols and images to not only drive learning, but also to improve recall. Linking things back to the community, the deconstruct, reconstruct method of teaching, and teaching shouldn't be linear. It is non-linear. So when we actually think about all those things, that is the essence of all good teaching. The land links is a little bit more unique to Indigenous communities, and that's something that we can focus on to sit there and talk about, how something not necessarily links back to the land per se, but it links back to nation building. Okay, so and I think that's something that we would probably in some ways weave in without it necessarily being the land. And so I guess that the point of this is that we can get really focused on the fact that Indigenous people learn differently to Western people. They don't. There's some differences that can enhance things, which we're going to talk about in the next couple of slides. But in terms of the theory of learning, is that if we actually sort of break these things down, is that this is how we should be teaching our students anyway, whether they're Indigenous or anything else. And if we're not doing that, then maybe we can. Maybe that's the point. And maybe it's not that we need to teach differently for Westernized versus Indigenous students. Maybe we're just not teaching our Westernized students very well, and we can actually learn and teach. But certainly when I teach, 7 of those 8 are already built into my teaching. And this is just a breakdown of all those things, the 8 links, and how you might connect those and strategies for doing those. We won't focus on any of them except for the land links, because that's the one that technically we don't do. And if we start to stop and think about it, what are land links? Place-based learning, linking content to the local land and place. And so that doesn't necessarily need to be the physical space. Is that what we need to do is make connections within it to say, if I'm teaching about nuclear medicine, that you're making a connection to the place where it's actually occurring, right? So in the nuclear medicine department. And, if we're talking about a nuclear medicine department that's located in a particular community, well, then that makes it nice and easy to make that connection too. So if students can't learn where we teach them, let's teach them where they learn, right? So that's just a modification on that previous thing that I've actually shown you. So that's just, I guess, my modification of that initial slide, and the application of that. We've sort of done a little bit at CSU. And so the next thing I want to talk about to link all that together is dream time. And we think about dream time as being, that storytelling, that idea of explaining phenomena that we see today, linking it to stories from the past. That there's no way to show whether it really occurred or it didn't occur. Whether it's the rainbow serpent or anything else, that it's no different to any other culture. The cultural beliefs around the Old Testament for Christians, and just about every community has some version of Dreamtime, these stories that explain the origins of things. What's unique to the Indigenous community is that their Dreamtime stories have survived intact for thousands of years. And so if you start to think, remember when you're in primary school and your teacher had you do this game of Chinese whispers. So everyone would sit, back to back, and the teacher would tell the first student a story. That student would pass the message on, whisper it into the second student's ear, who would whisper it into the third student's ear, and you'd go around the room. And by the time you got to the end, through 20 students, is that the story was completely different. There's no semblance of similarity with the story. And so how do we, in Dreamtime, how do the Indigenous folk maintain the story for such a, so similar for such a long time? And the reason for it is because it's actually built into a cultural bubble. And so when they tell stories through song and dance and ceremony. So it actually has this cultural bubble within which the story is told. And so the learning is weaved into cultural significance, and this is something that's really important, is that when we teach in a westernized world, is that do we actually link what we're teaching into cultural significance, or do we teach it as a fact-wise? Here's fact A, here's fact B, just believe me, it's true, right? So if you link something to cultural significance, and this is where the storytelling comes in. So I explain to students that this is the way we do something, and here's a story about this is how we communicate with patients, and here's a communication story that highlights why it's important to communicate that way. I create some sort of cultural significance and link, and so what you're doing is laying breadcrumbs. And so these cultural significant, I guess, ceremonies are breadcrumbs to improve the memory of the story, right? So when I'm actually sitting there trying to remember a story, or I'll remember a fact, then I actually connect it to the things that occurred at the same time or in similar times, and that's how I recall things. That's how we all recall things. And so our indigenous stories have these breadcrumbs that are laid along the ground to actually follow back along the path, so you actually get the story straight. So when you're doing the song or the dance or the ceremony, then each of those is creating triggers to remember that part of the story. So why is that important? How do we create breadcrumbs in the workplace or the classroom? And when I say the workplace, how do you get your patients to remember something? When we give them those instructions of what they've got to do while they're away, and you get some patients that do it exactly as you've said, and you get other patients that 2 minutes later they've forgotten what you said and they do it completely different. So how do we improve the message that's going across? How do I do it in the classroom? And so if we think about the classroom or the waiting room when you're telling the patient what the next step is, it's an artificial way of learning, and it's not inviting for Indigenous people, and it's not inviting for many other cultures as well. And so at this particular point in the workshop, we'd be in a room together, and I would actually ask everyone to take off their shoes and come outside with me. And to do that, take off your shoes and walk outside and feel the earth between your toes, and just close your eyes and sit on a chair with your feet in the grass and listen to the sounds of nature. Take in a deep breath. What can you smell? And it might not be nature. You might be living in suburbia, and all you can hear is the trucks going down the highway and the smell of a factory, or the smell of something else. So, but they're going to be senses. So listen to the sounds that you can hear, and breathe in and smell the smells, and think about what you can feel. What can you taste in the air, right? Let all your senses immerse yourself in that environment. So just take the time to do that, because this is how we should be learning. And so you're activating all your senses, and that not only creates the breadcrumbs for your learning, but it enhances each sense. The whole is greater than the sum of the parts. So before you actually pause the video and come back to it, just let me finish the next couple of things, and then you can head off and take your shoes off and do that, and then we'll discuss it in a live chat. So if you think about that, think about the strongest memories that you have as a childhood. So just take a few minutes to close your eyes, and even while I'm talking, thinking about those strongest memories that you actually have. What are the most significant memories? And most of them will be caged in strong multiple senses. So it's something that occurred that it wasn't just an event, but it was an event that stimulated more than one sense. So sights and sounds and smells and tastes, okay, and feels. And it could be emotional feel, it could be physical feel. If you think about a gift that you remember, and you may not remember the gift that you actually given specifically because it was a great gift, but because it was so carefully and beautifully wrapped. Or food that's presented really well. You don't remember it because of its taste, but you remember it because it looks so damn good. Is that you already know that and recognize your favorite chocolates based on the wrapper that it's in. Okay, so these are using multiple senses to actually create these breadcrumbs for memory. What's your favorite food, and what does it smell like? Does a song bring back an event? I remember when I was a young kid, Christmas came, and I got my record player for the first time. I know my older brother had one a couple of years before, and he wouldn't let me use it. I used to use it when he wasn't around, but so I got my own little record player, and I only had one record, and it was like, those favorites of whatever year it was. So the best of whatever year. And I sat on my beanbag with my headphones on, listening to that one album, A side, B side, while I read the book The Amityville Horror. And to this day, is that if I'm driving down the road and the radio comes on and plays a song, when they do one of those flashbacks to whatever year it was, and it plays one of those songs from that album, I will get a flashback to the Amityville Horror. I'll remember the page or the scene that I was reading. I'll be in the Red Room, for example. So it's really strong. These things are really, really strong, and I'm sure that you've got songs that will actually take you back to an event. And these can be good or bad. PTSD is an example. You know, there's plenty of war veterans who are triggered not by the sight of well, it could be from the sight of something, but it could be from the smell or the sound, that they have the flashbacks, and plenty of other sufferers of PTSD as well. And of course, you know, you'll all remember the scene from Silence of the Lambs when you know, the bleating of the lambs. He was playing on that same memory linked to sounds. And so we'll do that little walkabout and have that cultural immersion, and we'll come back. I think there's one more little instruction slide. And that's around yarning circles. So at this particular point, we would be walking outside, we would be taking our shoes off, we'd be feeling the grass or the dirt between our toes, we'd be hearing the sounds and smelling the you know, the atmosphere and hearing what we can hear. And we'd sit down in a circle, and the Indigenous folk use these yarning circles. And what it does is it actually creates a loop. It's inclusive, it's family, it's community. You know, when I stand at the front of the classroom and everyone's in this stacked row back, so you got row 1, row 2, row 3, there's no continuity, there's no, everyone is segregated. And it closes people off and it shuts down communication. You know, people in the front row don't know what the people in the second row and the third row are doing or saying or feeling or sensing. And so people don't ask questions. It's not as engaging. When you put everybody in a circle like this, is that all of a sudden is that everyone's looking at everybody else. Everybody's engaged in the same community and everybody contributes. It opens up the channels of communication. It gets people communicating. And so this is what we do here at CSU. Is that you can actually see this is our Port Macquarie campus, and we have our outdoor classroom that you can see up the top there. And you know, you've got your little round concrete slab where your teacher might start to walk around, and you can see up against the hill. You're still creating that linearity, but students take their shoes off and they've got their feet on the in the grass, and they get their chalk and they come down and they draw things on the ground. They draw things on the concrete. And then you can actually see that big old round thing at the bottom of the top image. And that, if you look down the bottom right corner, is our actually fire pit. And this is a yarning circle. And I love this yarning circle because you actually get the fire going in the middle. I think I've got it on the next slide. You've got the fire going in the middle. The smoke pops up out through the top. You can even do it in the rain. And what happens is that people quickly go from having their arms folded in front of each other and not communicating to all of a sudden is that they're actually open and relaxed and looking at each other and engaging and sharing. And it creates this amazing communication, and with that comes you know, some learning. So this is a workshop I did a year ago or so up at Port Macquarie campus. It was actually an international university teaching conference, so there was academics from all over the world that had come to do this, and I did this cultural immersion. And you can see down the bottom left, that's Andy Van, our Vice Chancellor, and a whole bunch of delegates from around the world. And the lady standing up on the right is our is Kate Thomas, who was going to co-present this workshop with me. She's a social worker, and we sort of worked on this together up in Port Macquarie. And so it worked really well, and within a few minutes is that everyone was relaxed and sharing, and the discussion was free-flowing, and it was actually a really rich learning environment. And so here you can actually see a class being conducted, and so even though those concrete blocks were designed to be seats, you can actually see that no one uses them as seats. People are standing on them, people are standing in front of them, beside them, they've got chalk in their hand, and they're drawing. So this is actually, I think it was an anatomy class that one of my colleagues was teaching, and they're just drawing what they are perceiving as the lesson on the concrete. And then of course, it gets washed away, and they start again the next day. And you can see over on the right here, this is one of the lessons that Kim Barry, my colleague up in Port Macquarie, was teaching. And so this is just a photo of a first year class talking about what nuclear medicine is, and the students were taking notes on the concrete with chalk rather than with their pens. And again here is that you can see down the bottom right, students they're covered in their chalk, but they've got their shoes off. They're enjoying the feel of nature on their toes, between their toes. And so this is actually a really important way of learning, not just for our Indigenous students, but for all students. So this is where we're at. So this is the point where we say goodbye, and I would really love it if any of this sort of hit home and made you start to think about how you learn and how other people learn, and how you can actually enrich the diversity of your workplace, enrich the diversity associated with student learning, and accommodate not just our Indigenous peoples but other peoples. So this is where it'd be really good if you managed to find some colleagues, either physically. I know that we've got our 1.5 metre rule, and we don't want to actually get too many people in the one spot together. So it might be something that you do when the restrictions are lifted, or you might do via your own little social pages. So maybe you can all have a little Zoom meeting, and there'll be 5, 10, 15 of you. And I think one of the beauties of these Zoom sessions is that it's a little bit like a yarning circle, because you're looking at everyone on your screen. Everyone feels like they're part of it. So without being in a physical circle, is that it actually brings everybody into the same venue. So think about how you might be able to do that. Go outside now, take your shoes off, have a cultural immersion. Listen to what you can hear, close those eyes and smell and feel, and think about how this cultural proficiency is something that you can attain and deliver in your workplace. And then get together with your colleagues and answer the following questions. So how can you create a new cultural space? Where is that cultural space? For me, the cultural space is not physical or electronic. It's within us. And whether us is an individual or us is a team, it's in us. And so we can't change the classrooms or our departments much, or even our online environments, but we can change how we engage in those cultural spaces, in the minds of our patients, the minds of our students, looking at how our patients and our students learn differently, understand things differently, have different cultural needs, how we make our space, both our physical and emotional space, more welcoming and inviting, how we create accessibility and safety for those people within those environments. So how we can create a quality of opportunity and access, not just access or the right to access. And see if we can enhance the learning outcomes and the health outcomes for our patients. So in those little groups, so either physically or in a little online discussion, sit down, find a relaxed place. If you've got 5 kids screaming in the background, it's probably not going to be good for you or the people on the other end. So try to find a relaxing time and space somewhere that you feel comfortable. And listen, feel and smell, and discuss with your colleagues, how you can create a new cultural space independent of the physical and electronic environments. Just think about what the challenges are for your workspace and how you might be able to overcome those. And I'd be really interested to hear, maybe a couple of weeks after this recording is released to ANZSNEM members and delegates, that after it's been released, that maybe a couple of weeks later that we actually get online and create a Zoom meeting where those that are that way inclined might come back and actually start to share some of those ideas and discuss what you've learnt and how we could move this forward. And that would also fit into the reflective template that you would do with the APRA ongoing CPD. So that's all I have. Hopefully that was useful. Hopefully it challenged you in some ways. We all have our own different cultural beliefs. Even if you're, the stereotypical Anglo-Saxon, you'll have your own cultural challenges and beliefs. And so it's rich for all of us. It's not just focus on Indigenous people. It's using the skills that we've talked about around the Indigenous people challenges to actually improve our cultural competence and cultural proficiency more broadly. So hopefully you got something out of that. And if you did, come back and have the online discussion that's set up, and hopefully we can do a few more of these with other topics and bring the cancelled conference outside and still manage to learn as a community.